In this video, I intend to tackle a giant topic: progression. Progression is a scary word in MS. And many times patients sit in front of me and they're fearful that I'll tell them they have secondary progressive MS, as if that's a stage 4 cancer diagnosis. All too often, I feel that both patients and doctors misunderstand concepts of progression in multiple sclerosis. And it's my hope that through this video, I can at least share with you how I like to think about MS progression. Howdy! Learn about MS with me, Boster. I started this channel to help my own MS clinic patients learn between clinic visits. It's my hope that through these videos, I can help you learn too. I use easy to understand language to bring you accurate and approachable multiple sclerosis education. If you're impacted by MS and you want to up your game, make sure to subscribe to the channel right now. And make sure to click that notifications bell so you don't miss any of our upcoming and new content. There's a term in MS called worsening. Worsening is a very, very honest term. You see someone in clinic and their neurological exam has gotten worse. It's not as good as it used to be. At that moment in time, you don't know as a clinician looking at the human why they're worse. They could become worse because they had an attack and they didn't fully recover. And I'll give you an example. Let's say that someone suffers an optic neuritis and loses vision completely in their left eye. And then after a course of steroids in a couple weeks to months, the vision comes back, but it only comes back about halfway. They can see, but they're left with a residual deficit. Their exam has worsened because of incomplete recovery from an attack. And that's one way that a person with MS can develop disability, by not fully recovering from an attack. That is not progression. There's another way that you can get worse. You can worsen on your neurological examination independent from an attack. And when we see that, worsening in the absence from an attack, that is what we refer to as progression. Now, in order to help you understand the concept of progression as I've just laid out, I'm going to take advantage of my friend Stephen Krieger's leaking pool model of multiple sclerosis. This model that I'll share with you was invented entirely by him. I had nothing to do with it, but I am a student of his work. And I find it very, very useful to share his model to help others like you understand these concepts in MS. So, I'm gonna throw up Stephen's leaky pool and we're gonna start to talk through it. What you see here is the cross section of a swimming pool. And on the left side, there's the deep end, and on the right side, there's the shallow end. You can see the floor of the pool, and then you can see the water level. And I've labeled the water level with a 1. So the water level represents the clinical threshold. In this model, anything that crests the water, that goes above the water level, is something that the human being is aware of. I can't see out of my eye. My arm is numb. My leg is weak. I have trouble with my bladder. These are things that the patient's aware of, and in the model, they would be represented as coming above the level of the water, above the clinical threshold. Everything below the water level, inside the water of the pool, under the water, is something that the human being is not aware of. There has been inflammatory damage, but you didn't know about it. It shows up on the MRI, however. When you have an MRI and you see a bunch of white spots and you think, well, I haven't had a bunch of those attacks, that's because they occurred in such a way that your nervous system could rewire itself and you were never made aware of it. And in this model, it's represented below the level of the water, below the clinical threshold. The volume of water in the pool represents the functional reserve. Functional reserve is a very important concept in multiple sclerosis. The functional reserve is really representing your nervous system's ability to withstand an insult. Now, by insult, I don't mean you're ugly. I mean your nervous system's ability to withstand losing a night of sleep or struggling with an infection. To make this clear to you, I'll use a personal example. When I was 18, I could skip a night of sleep. I just wouldn't sleep Friday night and I'd go about my day on Saturday and I'd catch up on my sleep on Saturday. Now, talking to you today in my mid-40s, it's exhausting even to share that story with you, because my functional reserve isn't what it used to be. As we age, our functional reserve gets smaller. And as I'll share in a little bit, unfortunately, in the setting of MS, it can dwindle even faster than we see with other folks that don't have MS. The very best correlate to functional reserve is brain volume, the size of the human's brain. And we know that people with multiple sclerosis are at risk for accelerated brain shrinkage, sometimes upwards of 10 times faster than the healthy population. Going back to the model, you notice that the shallow end of the pool has less water volume or less of a functional reserve compared to the deep end. And this is very relevant because the floor of the pool represents the central nervous system. And what you see in the pink section, in the shallow end, are the areas of the nervous system that have the least functional reserve. This would be the optic nerves, so the nerves that run from the eyeballs back into the brain, and the spinal cord, the superhighway that takes the information from the brain down to the feet and back up. Now, these structures in neurology, we use the term are eloquent. They don't have a lot of functional reserve, and damage to them generally doesn't go unnoticed. Now, if you move from the pink to the yellow section of the floor, the yellow section has a larger functional reserve than the pink section. This portion of the nervous system can handle insults a bit better than the optic nerves or spinal cord. And the yellow section represents the infratentorium, or the brainstem. These are the structures at the base of the brain, the midbrain, pons, medulla, and the cerebellum. And these structures control a lot of the nuclei that run cranial nerves. They do the delicate things of the eyes and the face, and they also help with balance and a myriad of functions. And damage to these structures also generally doesn't go unnoticed. You normally have symptoms. And as you can see based on the model, that's because there isn't as much water as in the green section. Now, the green section of the pool, where you see the most amount of functional reserve, the most amount of water, represents the supratentorium, the lobes, the hemispheres of the brain. And in the supratentorium, we have a tremendously large functional reserve. And so this is the way that Stephen's pool was laid out for us. Now, I always like to joke, nobody would like to swim in Stephen's pool. And as I switch the picture, I'll explain why. What you see here are these white stalagmites pushing up from the base of the pool into the water, and some of them crest the surface of the water and some of them don't. Each one of these stalagmites represents MS activity, meaning a clinical attack or a new spot on the MRI. If this stalagmite crests the surface of the water, as we see with example number 1, this would represent a clinical attack. Now, if you draw your attention to number 2, this is also inflammatory activity, but it doesn't crest the surface of the water. It's underneath the surface of the water. So the human being does not manifest an attack, but there is still structural damage. It's just going unnoticed by the human being. And now we turn our attention to the level of the water. I shared with you at the beginning of this video that Stephen's model is sometimes referred to as the leaking pool model of multiple sclerosis, because the pool is constantly losing water. Very slowly, year by year, the level of water drops. As the water level drops, it can literally uncover some of those stalagmites that were underneath the water level, and now they're exposed as the water level drops. Now remember that these stalagmites represented areas of activity where there was structural damage to the central nervous system, and the functional reserve was adequate to cover it up. But as we age and as years go on in the setting of multiple sclerosis and the water level slowly declines, those stalagmites are exposed. And what happens is we experience symptoms. Now, we experience them often in the absence of attacks, and we have clinical worsening without attack. This is the underpinnings of progression. Many patients will ask me, am I now in secondary progressive MS? As if that's a stage of cancer. And I really don't think about the disease in that fashion. The reality is it's much more complex than discrete relapsing or remitting and discrete secondary progressive. And as you can see from this model, an individual can have attacks and new clinical and radiographic activity, the white spots pushing up, and they can have the slow, steady decline of their functional reserve, the progression. And they can have both. Sometimes we'll see periods where there's more progression, and sometimes we'll see periods where there's more clinical activity, and sometimes we see neither. And so I do not find it useful to pigeonhole someone into a category. You have relapsing MS. You have progressive MS. No. On the contrary, I think that the disease is much more complex than that. People living with MS are at risk of having new activity, new clinical attacks, and new MRI activity, both of them causing structural damage to the holiest of holies, the central nervous system, the brain and spinal cord and optic nerves. And as they age and as their functional reserve slowly declines, those older areas of structural damage can develop into clinical problems through progression. And so we want to do everything and anything that we know how to slow brain volume loss and to maintain functional reserve. This is why you see recommendations of staying physically fit and participating in exercise as part of your lifestyle, because it has been shown to delay progression, to maintain brain volume, and conceptually to maintain functional reserve. This is similarly why we recommend that you drink alcohol only in moderation and avoid tobacco smoke, and it's why I implore people with MS to continue to take disease-modifying therapies. I hope that you found this didactic helpful, and I hope that it helps clarify some questions that you might have as it relates to progression in multiple sclerosis. In closing, I would love to hear your comments and questions. Please leave them below. Once again, my name's Aaron Boster with the Ohio Health MS Center. Thank you today for learning about MS with me, and until my next video, take care.